Welcome to a CNBC panel special on the role of the civil society-owned non-government organizations, as many of you may call them, during a pandemic. Now, we have a panel of experts in the industry to help us break this down. On this panel is Dr. Brenda Asimwe-Gatera, the country program manager at AIDS Health Foundation, also known as AHF in Rwanda. We're also joined by Samantha Diop, the country director of Girl Effect, and John Bosco Nyamazi, the executive secretary of the Rwanda Civil Society Platform. Thank you for joining us, ladies and gentlemen. Now, for some context, COVID-19 has impacted billions of lives around the globe. Governments, individuals, businesses, and civil society organizations are battling to save lives, support families, and keep businesses and other organizations afloat. Now, during these unprecedented times, the role of NGOs has become paramount in combating the virus and its impact on society's most vulnerable populations, especially in countries and regions where government services seem to be struggling. Now, some of the most affected are those that are seen as the people in the rural areas. Now, has the pandemic changed the way NGOs will operate? To start off this conversation, Dr. Brenda, you had that question. Has the pandemic changed the way NGOs will operate?
Thank you so much, Arnold. Definitely the pandemic has changed the way NGOs and other organizations operate. First of all, AHF, AIDS Healthcare Foundation, is an international NGO that has been working particularly in the health sector in collaboration with the government. And like other organizations who've been grossly affected by COVID, when the pandemic started, we could not sit back and just watch. We had to get involved in the response. Working in the health sector, of course, we were directly involved in the COVID response, offering technical support to the government, the task force teams, logistical support through provision of PPEs, protective equipment for the healthcare workers, reagents, tests, offering our staff to be part of the task force and take part in the response. And health facilities, of course, we had to prepare them to be able to screen, detect, and treat patients that came up, and people's livelihoods were affected. So we had to take part in the community response. As AHF, we had an emergency fund that we set up and offered support to local civil society organizations, provided food and other emergency support to the community. And secondly, we had to make sure that essential health services continued, because we wouldn't want to have another HIV resurgence, for example, or a resurgence in malaria just because there is another pandemic, COVID. So we had to ensure that people living with HIV continue taking their drugs, mothers continue coming to the health facilities for immunization and deliveries, and other essential services had to continue. In terms of the operations of the institution, we pivoted our response. Some of the activities could not be done, so we had to reallocate some of that funding, of course, in collaboration with our donors. And we had staffing issues to consider. Working from home, of course, was difficult. We had to ensure productivity while still working from home for many of the staff. And so the pandemic really affected us, but we had to pivot, and I think we're coming out of it much stronger than we were before.
Brenda, I'm guessing this has not been easy, especially keeping up with your normal day-to-day work. How have you been able to do that?
So thank you. We work in the health sector. So I should say that for us, the work has actually increased because we had to directly take part in the response. So in addition to our normal operations, we had to add other activities. So staff had to work extra hours in the fields as part of the contact tracing teams. We had to assign additional resources to be able to take part in the response alongside the government and other partners. So for us, we actually haven't had a rest. It has tripled in terms of our activities and the operations that we've had to run.
Bringing you into the conversation, Samantha, how has the pandemic affected the way Girl Effect operates?
Thanks, Arnold, for the question. So, yes, Girl Effect here in Rwanda, but also a global organization working in Ethiopia, Malawi, India, and Tanzania. So it's really affected everything that we do. But here specifically in Rwanda, much like Dr. Brenda has said, it's affected our ways of working, our programming, our staff in terms of workload, mental health. And we've just had to adapt really very quickly. So I think the 14th of March was the first case here, and many congrats to the government of Rwanda. Very swift action was taken. So early the following week, we came together as a senior management team and said, okay, how do we do the work that we do now going forward? Because as Girl Effect, we have a media youth brand called Niña Minga. So different to Dr. Brenda and her work, we're not on supply side, but we do demand. We create information for adolescent girls across Rwanda. So life-saving information that can, they make choices about their lives, whether it be SRH, sexual reproductive health, sorry for the acronym, economic empowerment, inspirational role model stories. And I have a team of amazing young journalists who usually go out across the country, meeting young girls face to face, all corners of Rwanda. So overnight, we had to pivot and think, okay, how do we still do what we do, which is create content as you are, Arnold. And we do that through radio show, magazine, and radio drama, digital content. So our ways of working completely changed. Our young journalist team had to do their interviews on the phone instead of meeting face to face. We face challenges that we work with the Rwanda Girl Guides, and it's normally our brand ambassadors, so Girl Guides in every district of Rwanda, who work with us to identify really interesting stories to bring to life the realities of girls across Rwanda. But with those restrictions, even those Girl Guides and brand ambassadors couldn't go out across the country. So we really had to rely on our relationships, our networks, to continue to create our content, our normal day-to-day content. What we also did was pivot the themes that we're working on. So we work very closely with the Ministry of Health, and also the Gender Monitoring Office, as well as a big project with Gavi, the Vaccine Alliance this year. And so what we did was make sure that the excellent information that is coming out from the government, that we took that and we tailored it for youth and particularly adolescent girls, because we understand the fears that they have, their anxieties. So really helping them understand, well, what does this mean for them that they are in their houses? What does lockdown mean? What are those behaviors? So again, on top of our already, our programmatic work, we then pivoted to COVID response in terms of providing that real social behavior change information, raising awareness. And then much like Dr. Brenda mentioned, we also tried to do everything we could in terms of response and supporting command center, for example. So providing a vehicle, providing our driver, if possible, really to help with the contact tracing. And then finally, so Arnold, if you allow me, I am also the vice chair of the network of NGOs here in Rwanda. So we're a network that brings together 80 international organizations, of which Dr. Brenda's organization is part of the network. And those 80 organizations cut across all different sectors. And what we do is networking, advocacy, and participation. And we all face common issues of funding, for example. So we had to repurpose funding, we had to negotiate with donors. Some donor funding was cut, so we really faced some challenges. But through it all, we came together with really positive partnership. And within that network, we managed to either reallocate or mobilize new resources and contribute the equivalent or $9 million to the efforts of the government in COVID response. A lot of NGOs that are part of that network, NGOs, then also carried out food distribution, really focused on what are the needs, particularly of the most vulnerable people within society. So whether that be widows or orphans, people particularly living with disabilities. So they engaged in food distribution, non-food items, mask distribution. So we really adapted everything that we could and shifted really to a more humanitarian focus for that period of time that was really critical. And then the final thing, if you allow me again, from the Girl Effect perspective, something that we really bring to the work here in Rwanda is we've been here for almost 10 years. We really have the trust of our audience. So we reach girls across the country, as I mentioned. But we also, through our bringing insight, so listening to girls, we reached out to girls who were already part of our network to ask them what their experiences are. We heard loud and clear that they felt anxious, that they were worried about returning to school, that they were really worried about the risks that they were facing. And we know that GBV and teen pregnancy is spiking this year. So we gathered their voices, those genuine insights, and we have tried all our best to feed those into different dialogues. So particularly this links to Jean Bosco's work with the RCSP. So particularly with organizations such as Rwanda Women's Network and then the SDG 5 Forum, also working with the Gender Monitoring Office. So bringing those realities that girls face in order then to respond and do advocacy for government programming and response.
I want to bring John Bosco into the conversation as the Executive Secretary of the civil society platform there. Could you just give us a sector analysis of how most of your members are coping during this pandemic? Are they able to carry out their operations? Have they changed the way that they are working?
Thank you so much, Arnold, for having us. Again, this is a wonderful opportunity for us to share with what the civil society has been doing in terms of responding to COVID-19. If you allow, I will first say what Rwanda Civil Society Platform is. Rwanda Civil Society Platform is a coordination apex body for civil society organizations working in Rwanda, basically the local civil society. And we have more than 11 umbrella organizations that have the membership of close to 1,500 local NGOs. You understand, which is our role is to coordinate those efforts, to represent those the members, but also to build the capacities of our members and deliver on advocacy, national level advocacy on issues that affect the community. So as you may know, the coronavirus pandemic is a defining global health crisis, not only a global health crisis, but also a socio-economic dilemma that has placed everyone in the world. It has affected every aspect of life, human industry, but of course, civil society was equally affected like anyone else, like any other organizations. Like the private sector was affected, but like the government was affected. But we are also glad that civil society has been one of the key partners to the government in response to COVID. For instance, when you look at Rwanda's economy, was slowing down from 9.6% its GDP to 2%. And you understand, even the contribution of civil society definitely has a share in that growth. So what was done, for instance, the civil society platform carried out a rapid survey to see how these NGOs, local civil society, are being affected. 75% lost funding. You understand how that is heavy to the local civil society. Almost 84% operations were completely halted. We are not able, to communicate with our beneficiaries on the grassroots levels. Even how we interact with them, how we provide services to them. Actually, if I would also look at the same survey, 55% of our local NGOs had to introduce new services, new interventions to be able to meet the population needs as a result of the issues that were placed, that were brought by the pandemic. In terms of responding to COVID-19, civil society has played a significant role in terms of prevention, response, but also trying to think in future how we can be able to respond. We have provided support to to the vulnerable groups whose livelihood challenges were aggravated by the pandemic, by providing to groups like people with disabilities through our network, NGOs. We're able to reach to 15 districts, people with HIV, widows and orphans. All that we are able to provide food and non-food items, distributing face masks, as my colleague Samantha said, but as well as joining hands with the network of international NGOs in our partnership, to reach out to the community, making awareness on the preventive measures. But the important thing here to note was the partnership with international NGOs, the partnership with government authorities, as highlighted in its national development plans and the government ambitions, the role of civil society, right from the EDPRS 1, EDPRS 2, that is economic development and poverty reduction strategy, the Vision 2020 that we are concluding now, even in the Vision 2050, where the country envisages to be a middle-income country and high-income status. So when you look at the role of civil society, is very well articulated in those development instruments. So the civil society has played a significant role. Samantha just talked about the 9 billions that Rwanda francs that were collected in areas of food security, as in health, but as well as like 2 billion went to the Ministry of Health to support in response to the COVID-19. I think the important point to put here, the method that we really encourage, you talked about the coping mechanisms. We are trying to work to ensure that at least we have leveraging domestic funding sources, because we have seen that the funding was not enough in terms of supporting our interventions, but also investing in strong partnerships.
John Bosco, very, very detailed analysis. Just wanted to bring Brenda back into the conversation a little bit. Brenda, and we're going to get back to you, John Bosco. Brenda, how has the current situation affected your funding?
As AHF, we've had to reallocate some of our funding. So because AHF does not really depend on donors per se, our funding was still intact, but we had to reallocate it from some operations that could not be done, some activities that were not carried out, and reallocate that to the COVID response. However, I'm also as part of NGO, I head the Health Technical Working Group. I know that for some organizations, funding was cut severely, and particularly for the local CSOs as well. I've had a couple of reports that their funding was really cut, and that of course affected their operations as an organization.
In terms of funding, Brenda's hinted on, some civil society organizations having to look for alternative sources of funding. Could this affect the workings of many of the civil society organizations, and how many of them will be able to bounce back after the pandemic?
That's a really good question, and I wish I had a crystal ball, because I think we're in this situation of uncertainty and unknowns. So as Dr. Brenda said, many organizations have, they'd won bids, they were part of consortium funding, but those fundings got cancelled. And I think for many organizations like Girl Effect, this year we've had a lot of flexibility with our donors. So we've had a no-cost extension, so we can do the same activities, but over a longer period of time to spend that money because of the delays because of COVID. And actually for COVID response, we've had a few extra incomes so that we could do some more, COVID work for adolescent girls. But I think Girl Effect, much like other NGOs, is the future of uncertainty. So with, bilaterals, government funding, priorities changing, and as I mentioned, kind of the cancellation of some funding pots, I think we'll still see the ripple effect in years to come. So maybe next year or the year after. And I think what we're all doing now, I think Bosco mentioned it, but there are positives. It sounds like an oxymoron, but there have been positives to the pandemic in that it has really increased collaboration. It's increased the sense of solidarity, both within Rwanda, but also globally. We are all in this together, albeit in different situations. And I think what we're already seeing here in Rwanda with our response as civil society generally, not dividing NGOs and CSOs, is this collaboration and more efforts now with the scarce resources that may be there, like the calls for proposals that come out or different funding pots, that we see how we can work together. So, the comparative advantages of maybe Girl Effect and AHF and some civil society organizations, rather than a sense of competitiveness and that we're against each other, but let's come together to apply for funds. Because ultimately we all have, we're driving towards the same vision, which is NST, National Transformation for Rwanda, with slightly different missions and slightly different target groups. But ultimately, as Girl Effect, we want to do everything that we can to empower adolescent girls. If we can do that collaboratively, even better. But the funding scene for, I would say, the majority of NGOs plus CSOs in Rwanda is a cause for concern and something that we are really trying to overcome in the future.
I bring John Bosco back into the conversation. And John Bosco, these in your closing remarks, as we've really run out of time, unfortunately. Now, could the role of civil society organizations change drastically as a result of the current situation?
Okay, thank you so much, Arnold, once again. I think what we need to do, as my colleagues said, we need to repurpose the funding, but also reorient our operations, because the needs are going to change, the issues for advocates are going to change. So we'll need to reorient our operations, but also leverage on the domestic funding, as I said, and rethink the community engagement approaches, because if the pandemic continues in this perspective, we really need to see how do we engage our communities, how do we need to continue doing the work, the role of the civil society despite the pandemic, but also invest in the use of innovations and ICT, because, for instance, we have seen CSOs, NGOs working from home, as well as government, but and many of them were not ready. So we really need to invest in preparedness, on how we can invest into these new approaches, especially the preparedness. For instance, when we have another pandemic like COVID-19, how do we do our things? How are we able to position ourselves to continue serving the community, to continue reaching out to their demands? So there was another thing we're thinking of, setting up a civil society emergency fund, whereby different actors from government, development partners, putting in some money, and this money should be having a clear purpose and focus on how to address these challenges that are being aggravated by the pandemic, but as well as looking into future work, continuing our role, but in a way that will respond to the needs of the communities.
And Dr. Brenda, in your closing remarks, has this changed the way you're going to operate moving forward?
Definitely, Arnold. We need to learn from what has happened. We would be fools if we went back to the pre-normal. So we definitely need to adopt. We need to rebuild. We need to respond better. The COVID-19 pandemic took all of us by surprise. The next one should not take us by surprise. We have to build resilience. We have to prepare better and build long-lasting, sustainable systems in collaboration with the government and communities and other partners to be able to respond much better to the next pandemic. Hopefully, it will find us in a much better spot. And we have to ask the difficult questions and do the difficult tasks. What measures are there to protect the vulnerable, for example? What form of social protection do we have? How can we leverage technology like my colleague has mentioned? So we definitely have to move forward in the new normal and redesign our projects to be able to respond holistically, collaboratively, and in partnership at all levels, and more so with the community as the grassroots, the linchpin of the response. Community engagement is going to be very, very important.
Samantha, in your closing remarks, what does the future hold for CSOs on the continent?
Thank you, Arnold. So the future, I think it's more of the same but different. So our role is still really critical in, I think my expert colleagues have said it all pretty much. But we are part of the linkage between CSO and government. We have the privileged position of being a facilitator, being a convener in situations where we can actually help raise the voice of communities and citizens. We do that. But in situations where that's not possible, we amplify that. We learn from citizens. I think the future for CSOs is to continue to really understand what citizens need, what they're going through, their challenges, and from my perspective, particularly adolescent girls and youth in general, and continuing to raise that voice and amplifying their needs wherever possible. Both my colleagues mentioned it, but digital, us being really nimble, no matter whether you're a big or small organization, an INGO or a CSO, but the way that we've had to adapt this year, there's no going back now, into ways of working, into sense of collaboration, into digital platforms. And we all know that Rwanda is very ambitious in terms of digital technology. And we have seen a huge uptake in content, online learning for schools, lessons on radio, the use of IVR, SMS, Facebook, other platforms. And as Girl Effect, we've seen our IVR line 1019 and SMS hugely increasing. So how can we really try and make sure that on the one hand, we're leaving no one behind? So we're still reaching communities face to face and girls face to face, but where that is increasingly difficult because of restrictions, and hopefully it won't be like that forever, how can we also use technology and innovation? So I think we need to move with the times, we need to adapt, but also we need to be much better at scenario planning. So I think Dr. Brenda said, it took us by surprise. It shouldn't have taken us by surprise. So we really need to be ready to respond and continue to use our position, which is a very privileged position, to work with youth and government for our development. Thank you
very much. Thank you very much, Samantha. Unfortunately, we'll have to cut you short. Thank you for joining us, ladies and gentlemen. And as always, if you want to be part of this conversation, you can tweet us at CNBC Africa, or you could tag me directly at The Real Quizzer. Have a great day.